COVID vaccine, PM to have AstraZeneca's jab as he urges public to do the same. The Prime Minister is to receive his first dose of the Oxford AstraZeneca COVID-19 vaccine after reassuring the public it was safe. Boris Johnson, 56, has urged people to get inoculated and said England's roadmap out of lockdown was on track. He said there was no change to the plan despite a drop in vaccine supply. Several European countries are to resume using the AstraZeneca jab after the European Medicines Agency confirmed it was safe and effective. The regulator revealed the vaccine amid fears about broadcast, but said it was not associated with a higher risk and the benefits outweighed the risk. Mr. Johnson told a Downing Street conference on Thursday that the AstraZeneca jab was safe, but the thing that isn't safe is catching COVID, which is why it is so important that we all get our jabs as soon as our turn comes. The Prime Minister was himself treated in hospital for COVID-19 in April 2020 during the first wave of the pandemic. The way to ensure this lockdown easing happens is to get that jab when your turn comes. So let's get the jab done, he said. Prof. Chris Whitty, Chief Medical Officer for England, said there were anecdotal reports of small numbers of people not turning up for vaccine appointments following the controversy over the AstraZeneca jab in Europe. But he said he expected many of those who decide to get the jab after a pause for fraud, adding that COVID was still a very dangerous disease. People dying, people getting significant blood clotting problems, that's one of the risks of COVID. People having long-term physical and mental effects from COVID, he said. Mr. Johnson said England's progress towards lifting restrictions on daily life was unchecked by vaccine supply issues, where fewer doses have arrived from India than initially expected. There were often delays with vaccine rollout programs, he said, and he stressed the Indian government had not stopped any exports. Prof. Neil Ferguson from Imperial College London said while the delay was disappointing, he did not think it would have an enormous effect on the rollout. However, he warned the UK leader to keep variants of concern at bay until it could update vaccines and roll them out to the whole population. Prof. Ferguson, who is a member of the government's SPI and monitoring group, told BBC Video 4's Today program there should be particular concern about cases being imported from France, where infection levels are increasing. He added that 5 to 10% cases in France were the South African variant, which is of concern about because it could be more resistant to current vaccines. But Prof. Ferguson suggested that adding France to the red list of countries from which arrivals are required to quarantine in a hotel will not be practical given the amount of essential trade between the UK and France. Instead, he said, a more bespoke arrangements to mitigate the risk, perhaps including testing of arrivals, would be lead. Culture Secretary Oliver Dowden said rising infection rates in Europe should act as a wake-up call, and the travel list was kept under regular review. The European medical regulator had reviewed the AstraZeneca jab after 13 countries in Europe suspended its use over fears about blood clots in a very small number of patients. France, Germany, and Italy, along with
Cyprus, Latvia, and Lithuania.
Cyprus, Latvia, and Lithuania are to resume use of the jet on Friday, while Portugal, and the Netherlands will do so next week, but Norway, Sweden, and Denmark have said they will continue to pause the use of the AstraZeneca vaccine while they conduct their own independent reviews. Like his UK counterpart, French Prime Minister Jean Castex will receive the AstraZeneca vaccine in an effort to sway a doubtful French public. Sir Kent Roos, former chairman of the EMA, told BBC Breakfast the pause of the rollout of the AstraZeneca jab in some European countries was unfortunate because it could damage public confidence. Prof. Andrew Poland, director of the Oxford Vaccine Group, said the EMA findings would help rebuild confidence, and it was reassuring that safety monitoring was taking place. In the UK, the Medicines and Healthcare Products Regulatory Agency also concluded that any link between the JAK and clots was unproven. The MHRA and the EMA say people can have confidence in the vaccine's benefits and should get immunized by anyone with a headache lasting more than 4 days after vaccination should seek medical advice as a precaution. The same advice applies if someone develops unusual breathing. That is because the regulators have received a very small number of reports of the extremely rare form of blood clot occurring in the brain. It is this type of clot that triggered some European countries to pause rollout of the Oxford AstraZeneca vaccine. In the UK, 5 cases of cerebral sinus vein thrombosis among 11 million people who have received the vaccine occurred in men aged between 19 and 59. One of these was fatal. The EMA has received an additional 13 reports of CSVT. The World Health Organization has called on countries to continue using the vaccine and is due to release the results of its own review into the vaccine safety later on Friday. When might people receive their first vaccine dose? Meanwhile, the UK saw 7% more deaths than would be expected in 2020 based on the previous 5 years, according to new figures from the Office for National Statistics covering up to mid-December. In experience, one of the worst death rates in Europe is in the first half of 2020, but has since been overtaken by Poland, Spain, Belgium, Bulgaria, and Czech Republic and Slovenia.